The Mississippi Association of Nurse Practitioners is the first and only specialty association for nurse practitioners in the state of Mississippi. And its goals are basically to provide advocacy for the NPs in the state, as well as continuing education, networking opportunities, and a connection with national nurse practitioner associations. We currently have over 300 members of MANP, and my goal is to grow the association substantially over the next 3 to 5 years, both in terms of membership and financially. I would really like to see us, during that period of time, grow the association to 1,500 members at least. Probably the biggest issue facing NPs in our state is that they are currently not allowed to practice at the full scope of practice. There are currently 21 states in the District of Columbia that have what is known as full practice authority for nurse practitioners. And we are advocating currently in the legislature to achieve that for our nurse practitioners in Mississippi. I think the other issue facing all of us are the problems associated with access to care in our state. And so as we're representing the nurse practitioners in Mississippi, we're also working and partnering with other organizations to improve access to care. And we believe that full practice authority for nurse practitioners will help us accomplish that. I do. There are currently 3,700 advanced practice nurses in Mississippi, most of which are nurse practitioners. It's anticipated that by the year 2025, the number of nurse practitioners, both in our state and nationally, will double. So increasingly, access to care is a problem that's being solved by nurse practitioners, particularly in rural, underserved areas. And we will continue to see an increase in patients seeing nurse practitioners as their primary care providers. It is. Healthcare, as you know, has skyrocketing costs associated with it. And nurse practitioners provide care to their patients at a rate that's less than that provided by physicians. So as more and more nurse practitioners are providing care in our state and are providing preventative care to patients in our state, the cost of health care will go down. Nurse practitioners are excellent providers in terms of preventative care and encouraging their patients and working with their patients to eliminate some of the chronic conditions that many patients in Mississippi face. So by doing that, the cost of health care will go down as more and more of these patients overcome their chronic conditions. It is. Both nursing and advanced practice nursing are both excellent careers for young people, male and female. And nurse practitioners in particular earn very good salaries, usually in the $100,000 area, and they are in a field which provides them with a lot of personal satisfaction and career satisfaction too. Many nurse practitioners own their own clinics. 90% of them practice in primary care, and they receive a lot of personal satisfaction and reward from taking care of their patients.